Namaste, I am Dr. Payal Khandelwal, Senior Ayurveda and Panchakarma Consultant practicing in Whitefield, Bangalore. Liver, gut issues and Ayurveda. Today let's discuss about what Ayurveda thinks about and treats the liver issues, gut issues with Ayurvedic treatment protocols. How does it do that? So number one, we always assess the patient based on the symptoms that the patient has got to us with. For example, if the patient is suffering from any chronic liver disorders or any gut disorders, there are certain specific symptoms which might be categorized into Vata, Pitta and Kapha. So for example, if the patient has a lot of bloating, indigestion, pain, irregular appetite or severe constipation, we categorize it into Vata problems. The Pitta problems are more like gastric burning issues, acidity, headache, vomiting which can be associated, or bleeding through the anus. So we associate it with Pitta or the heat element. And the third is the Kapha, in which there could be mucus discharge, sticky discharge in the stools being very sticky, if the person is feeling very lethargic, the appetite is gone down and the person always feels very heavy in the body. So this can be categorized under Kapha, or it could be a combination of these symptoms. So according to that, first is the assessment that we do. Second, we find out a thing called as AMA. AMA is the toxin level or the toxin score of the body. So we find out based on the looking at the tongue, whether the tongue is coated, whether the person is able to digest food or not, or whether he is having lethargy, sluggishness, lack of appetite and is always feeling a lot of swelling in the body. So that indicates AMA. The third concept is, after we find out this, what do we do? Then we begin with the treatment protocol, where first foremost focus is on improving the Agni. Remember, the liver and the gut is interconnected. It's not a different system which is working outside the body. Everything inside the body is interconnected. So the whole perspective of Ayurveda is to look at it as an interconnected system and work at the core of it. So what is the core of it? Is improving the digestive fire or improving the digestion and the metabolism of the person. So we give medications which will first rekindle the Agni or the digestion in the person. Once it is set or once it is properly balanced, then whatever food the person is eating, he will be able to digest that. So that is the first concept, where we do the rekindling of the digestion. Second is removing the toxins and clearing the subtle channels of the body. So detoxification of the body through Amapachan, that is through digestion of the toxins in the body. The third step is, if needed, we go with Panchakarma treatments. So Panchakarma is not for everyone. We have to definitely go through the indications and the contraindications. But in case of Pitta disorders, we prefer giving Virechana, that is purgation. In case of Kapha disorders, we prefer giving Vamana, that is therapeutic emesis. In case of Vata disorders, we go with Basti treatments. So these are some of the important treatment protocols that we follow. And the next is repairing and improving the gut health. So the whole system is around 20 to 22 feet long tube which can have inflammation in various points. So when we give medications, we help the healing of the gut, we help improving the gastric mucosal lining, we help improving the intestinal mucosal lining and the peristaltic movement. So everything works like a coordinated orchestra and there is no disturbances. But the most important aspect towards the end is also corrections in the diet and the lifestyle of the person. So there are 4 important factors which we need to recorrect along with medications. Number 1, the food of the person needs to be corrected. Second, proper exercise regime has to be advised. Third is stress control, yes, because the brain and the gut is interrelated. So if we do not work on this axis, which Ayurveda has been saying since last 5,000 years, that the brain and the gut are interrelated. So we have to work on the stress of the person. And fourth is fixing the sleep cycle. If we do not fix all these 4 categories, then we are not holistically serving the patient. So this is how we holistically think and treat each and every disorder, whether it is chronic liver disorders or whether it is gut disorders. And we give organ specific or system specific medicines which help in re-strengthening the core potential of that organ. So this is how we think about liver and gut issues and the treatment protocols in Ayurveda. Thank you.